Digestion. When we eat foods such as bread, meat, and vegetable, they are not in a form that the body can use for nourishment. Food and drink must be changed into smaller molecules of nutrients before they can be absorbed into blood and carried to cell throughout the body. Digestion is the process by which food is broken down into its smallest parts so the body can use them to build and nourish cells and to provide energy. Digestion involves mixing of food with digestive juices, moving it through the digestive tract, and breaking down large molecules of food into smaller molecules. Digestion begins in the mouth when you chew and swallow and is completed in the small intestine. The digestive system is made up of the digestive tract, a series of hollow organs, joined and along, fasting tube for the mouth to the anus and other organs that help the body break down and absorb food. There are also two solid digestive organs, the liver and the pancreas, which produce juices that reach the intestine through small tubes. In addition, parts of other organ system, for instance nerves and blood, play major role in the digestive system. Mechanical and chemical digestion in oral cavity. The gastrointestinal tract starts in the oral cavity where your teeth grind and chew food, breaking into small manageable pieces. This chewing process is known as mastication. It dependent upon powerful muscles, masseter and temporalis, as well as smaller muscles that permit fine control. They move the mandible, lower jawbone against the upper jaw, enable crushing of relatively hard food. Mastication causes exocrine gland under the tongue and in the back of the mouth to secrete a watery liquid called saliva, which performs two essential functions. It moistens and compacts the chewed food so your tongue can roll it into a ball bolus and push it to the back of your mouth for swallowing and easy passage through the pharynx and esophagus. In addition, saliva contains digestive enzymes, salivary amylase, which begins the breakdown of carbohydrates. Mastication and saliva secretion work in harmony. Chewing increases the surface area of food, which help to accelerate the breakdown of starch molecules into simple sugars. By the digestive enzymes, almost no protein or fat digestion occurs in the mouth, except for the release of lingual lipase, an enzyme secreted by adrenal gland on the dorsal surface of the tongue. The action of the teeth and tongue prepare food for swallowing. When you are ready to swallow, the tongue pushes a piece of chewed food, a bolus, toward the stomach to prevent food in the throat from rising into the nasal cavity or moving down the windpipe trachea. The act of swallowing triggers into involuntary events. The soft palate, the back of the roof of the mouth, closes up the nasal cavity while epiglottis, a flap of cartilage attached to the root of the tongue, tilts downward to seal the trachea. The swallowing procedure is regulated by nerves in the medulla oblongata and pons. The reflex is instigated by receptors in the throat as a bolus of food is pushed to the back of the mouth by tongue. Swallowing process. The three stages of swallowing are as follows. Stage 1, the oral stage. Food is placed the mouth. The process of chewing together with stimulation of gums and palate by moving of food begin some of the reflex activities which take over. Once the food moves into stage 2, the pharynx, enzyme in the saliva help to pump the food into a bolus, which the tongue squeezes into pharynx by moving up towards the palate. The pharyngeal stage. The larynx lifts up to meet the epiglottis, which lowers, making a seal that prevents material from entering the pipe. This is important as it stops food or liquid from being aspirated into the lungs. The esophageal stage. The bolus is passed into the esophagus by automatic contraction of the pharynx. It then travels to stomach by gravity and reflex action. This state of swallowing is entirely automatic and cannot be controlled. Peristalsis. Once the food ball enters the esophagus, it is pushed toward the cardiac sphincter by smooth muscle contraction called peristalsis. Food travels from the mouth to the stomach in about 4 to 8 seconds. Peristalsis occurs throughout the length of the digestive tract and is responsible for keeping things moving and the occasional strange sound that arise. That is, the digestive tract is surrounded by both circular and longitudinal smooth muscle that allows for rhythmic contraction or peristalsis. Food and stomach. Food enters the stomach from the esophagus through the lower esophageal sphincter. The stomach is the part where physical and chemical breakdown of food really begins. It appears like a food mixer churning up the food bolus to pulp called chyme and releasing numerous chemicals such as digestive hormones, enzymes, and gastric juices which help to break down food molecules in the chyme into small intestine. This is the structure of stomach. This one is esophagus. This one is cardiac end, fundus, longitudinal layer, circular layer, oblique layer, body, greater curvature, gastric folds, pylorus, pyloric end, duodenum, first part of small intestine. This one is pyloric sphincter. Particles for further digestion. An empty stomach has a volume of approximately 50 milliliter. But typically, after a meal, its capacity expands to about 1 liter of food and may expand to hold as much as 4 liters. The chyme slowly exits the stomach where the pyloric sphincter or valve and passes into the duodenum, the first segment of small intestine where digestion continues. Structure of stomach. The stomach is a muscular organ located on the left side of upper abdomen. Subdivided into 4 regions. Cardiac region. Here, the contents of the esophagus empty into the stomach through lower esophageal or cardiac sphincter. Fundus, an expanded area covering up above the esophageal opening. Pylorus, the narrow end of stomach that joins the small intestine at pyloric sphincter, like cardiac sphincter. The pyloric sphincter is a ring of muscle that regulates the movement of food out of the stomach. The wall of the stomach is lined with millions of gastric glands, which together secrete 400 to 800 milliliter of gastric juice. Several kinds of cells found in the digestive gastric glands: parietal cells, sheep cells, mucus secreting cells, hormone secreting endocrine cells. Parietal cells. Parietal cells secrete hydrochloric acid, intrinsic factor. Hydrochloric acid. Parietal cells contain H plus. This transmembrane protein secrete H plus ions, proton active transport using ATP. The concentration in the gastric juice can be as 0.15 m giving gastric juice somewhat less than 1. Intrinsic factor. Intrinsic factor is a protein that bind and ingested vitamin B12 and enable it to be absorbed by intestine in intact form. Chief cells. The chief cells synthesize and secrete pepsinogen, the precursor to the proteolytic enzyme pepsin, mucus secreting cells. Special cells secrete a protective coating called mucus on the stomach walls to prevent damage from gastric acids. Originally, it was thought that peptic ulcers were caused by an erosion of this mucus lining by these acids. However, recent research indicates that these ulcers are caused largely by the spread of a type of bacteria called Helicobacter pylori bacterium into the gastric walls. Hormone secreting cells. Secretion by the gastric gland is stimulated by the hormone gastrin. Gastrin is released by endocrine cells in the stomach in response to the arrival of food. Absorption in stomach. Very little absorption occurs in stomach. This is more important point. However, some water contain ions and drugs like aspirin and ethanol are absorbed from the stomach into the blood, accounting for the quick relief of a headache after swallowing aspirin. Function of stomach. Although it is very complex organ which perform a wide variety of digestive actions, the stomach has three main functions. It stores the food, thus allows us to eat a large number of food calories in a relatively short time and then digest it a longer small amount of food continuously throughout the day because the small intestine digests food very slowly. It breaks down large fat and protein molecule into food so they can be absorbed in small intestine. To do this, the stomach releases a number of powerful gastric juices containing hydrochloric acid and other digestive enzymes in addition to breaking down food. These acidic juices, pH 1 to 3, also kill bacteria in the food. For easier digestion, powerful muscle in the stomach wall come the food into a paste of porridge-like consistency called chyme. This churning action also ensures that the secreted gastric acids and enzymes are thoroughly mixed with the food. It empties the partially digested chyme into the duodenum, the first segment of small intestine, at a manageable speed through the pyloric sphincter while the intestine is full and still digesting food. The stomach acts as storage area for food. The absorption of food and water by the stomach is negligible, but iron and highly fat-soluble substances like alcohol are absorbed directly. Mechanism of secretion of gastric juice. An interesting question is raised here. What causes gastric juice to be secreted? There are two possible answers to this question: chemical control and nervous control. Sometimes even the sight, smell, taste, or hearing of delicious food stimulate the nervous system, which orders for the secretion of small amount of gastric juice like watering of mouth. This is proved by experiment of Russian Paulo. He cut the esophagus of a dog and left the cut and open to the outside. When he fed this dog, the food of course never reached the stomach. Yet the stomach resulted in the secretion about one-fourth of the normal amount of gastric juice. This showed that gastric secretion was under the reflex control and cutting up the gastric nerves fruit at. If there are more protein in the food, a signal is sent to brain, which in response to this signal order the gastric gland to secrete more gastric juice. A hormone called gastrin controls the secretion of gastric juice. Protein molecules stimulate the endocrine cells of the stomach to secrete gastrin. The liberating gastrin is soon absorbed by the blood, which carries it to the gastric gland to secrete large amount of gastric juice in the stomach. The contact of food with the lining of the stomach also causes the cell to secrete gastrin, which stimulate the gastric gland to secrete gastric juice. Food in the small intestine. As the contents of the stomach become thoroughly liquefied, they pass into duodenum, the first segment about 10 inches long of the small intestine. Food typically takes 4 to 5 hours to pass through the stomach into the duodenum, the first part of small intestine. After being churned and mixed with digestive juices in the stomach, food came more slowly into the folds of the small intestine through the pyloric sphincter or valve. The small intestine or small bowel is the longest section of the digestive tract, approximately 17 feet, and is divided into three segments: the duodenum, jejunum, and ileum, each of which performs different digestive functions. Chyme from the stomach is propelled through the small intestine by peristalsis. Function of small intestine. The small intestine is where most chemical digestion takes place. Peptides, complex chains of protein molecules, are broken down into amino acids. Lipids, fats, are broken down into fatty acids and glycerol. And carbohydrates are broken down into simple sugar like glucose. To accomplish this, chyme is mixed with addition digestive juices, including bile. From the liver and pancreatic juice, the amylase form the pancreas, as well as other intestinal enzymes such as maltase, lactase, and sucrase to break down the chyme and assist in nutrient absorption. Absorbed nutrients flow in the bloodstream to the liver, where they are further metabolized and then either stored or sent to cells in other parts of the body. In total, food typically takes 4 to 5 hours to transit all three sections of the small intestine. Along the way, its consistency changes from porridge chyme to a thin, watery mixture. Digestive function of the duodenum. The duodenum continues the process of food breakdown. Its name stems from the Latin duodenum digitorum, meaning 12 fingers or inches. It is roughly horseshoe shaped. Anatomically, it is subdivided into 4 segments: the superior, descending, horizontal, and ascending duodenum. Inside the duodenal tube, chyme is mixed with fluids from the gallbladder and pancreas. Bile breaks down fat particles into smaller droplets, while pancreatic juice contains enzymes that convert fats into fatty acids and glycerol, and sodium bicarbonate to neutralize stomach acid. Digestive function of the jejunum. Roughly 4 to 7 feet in length, the jejunum is where chemical breakdown of food chyme is completed. Pancreatic enzymes, along with enzymes produced by the jejunum wall, finalize the food digestion process. The term jejunum stems from the Latin jejunus, meaning empty. Digestive function of the ileum. Ileum is 5 to 7 feet long. It is the final section of the intestine and is connected to large intestine by the LUC value, the main function of the ileum is to absorb nutrients. Bile is also absorbed here and returns to the liver through blood vessels in the intestinal walls. The unabsorbed watery remains of the food chyme now pass into the large intestine for watery removal and final processing before being expelled from the body. Absorption of nutrients in small intestine. Very important topic. It is inside the small intestine that we absorb most of nutrients in our food. Although the small intestine has a relatively small diameter, the intestinal walls are covered in wrinkles called rugae, which are themselves covered in millions of finger-like projections called villi, which are themselves studded with millions of smaller projections called microvilli. This provides surface area of about the size of a tennis court for nutrients absorption. Inside each villus is a series of lymph vessels, lacteals, and blood vessels capillaries. The lacteal lymph vessel absorb digested fat into lymphatic system, which eventually drains into the bloodstream. The blood vessels receive other nutrients and transport them via the hepatic portal vein to the liver. Here, the blood is filtered, toxins are removed, and the nutrients are processed. An important task performed by the liver in this context is the regulation of blood glucose level to provide sufficient energy for the body. Excess glucose is converted in the liver to glycogen in response to the hormone insulin and stored. When blood glucose levels begin to drop, for example between meals, the glycogen is reconverted to glucose in response to messages conveyed by the hormone glucagon. Digestion in large intestine. After all nutrients have been absorbed from the ingested food during its passage through the small intestine, the watery waste passes into the large intestine. It is the final section of the gastrointestinal tract and its main function is to remove water plus any remaining minerals from the food waste and compress it into a form for easy expulsion from the body. As the chyme passes through the large intestine, the water is removed and the chyme is combined with mucus and bacteria, gut flora, and is converted into feces. As in the esophagus, small intestine, undigested food is propelled through the large intestine by valves of muscular contraction and expansion called peristalsis. However, unlike in small intestine, where these valves occurs at irregular intervals, peristalsis in the large intestine is continuous and 2-3 times a day. A more vigorous type of movement, gastrocolic reflex, occurs which propels material towards the rectum and anus. As waste matter is pushed into the rectum, it triggers a desire to defecate. Structure of large intestine. The large intestine, also referred to as the large bowel or the lower gastrointestinal tract, the thick tube of about 5 feet in length, which gets progressively narrower in diameter. It consists of 4 regions: the cecum, colon, rectum, and anal canal. The term colon is sometimes used to describe the entire large intestine. The cecum is a short pouch into which food enter from the ileum and exit into the ascending colon of the large intestine. The colon is the longest segment of large intestine. It is subdivided into 4 sections, named after their position in the pelvis: the ascending colon, transverse colon, descending colon, and sigmoid colon. The rectum as the final part of large intestine. Feces formed in the colon collect the rectum before being excreted via the anus. After The rectum comes the anal canal, a short passage about 1.5 inches long, terminating into two muscular rings. Internal and external sphincter. As waste product from the rectum pass into anal canal, nerves in the rectum cause the internal sphincter to relax and open. Then the external sphincter also relaxes, permitting fecal discharge. Defecation may be involuntary or under voluntary control. Young children learn voluntary control through the process of toilet training. Once trained, loss of control causing fecal inconvenience may be caused by physical injury such as damage to the anal sphincter, intense pride, inflammatory bowel disease, impaired water absorption in the colon, and physiological or neurological factors. Liver. The liver is one of the most important and largest organ in human body. It is located in central position, but the largest part in the whole body is skin. This is not the liver. This is second most largest part. And is closely involved in almost every aspect of the body physiological activities because of its central role. Liver disease can be extremely life-threatening. The liver has multitude of important and complex functions. Some of these functions are carbohydrate metabolism. Glucose is vital energy source for cells and its level in the bloodstream must remain constant. The liver helps maintain blood glucose level in response to the pancreatic hormones, insulin and glucagon. After a meal, glucose enters the liver and levels of food glucose rise. This excess glucose is dealt with by glycogenesis, in which the liver converts glucose into glycogen phosphorate. The glucose that is not stored and used to produce energy by a process called glycolysis. This occurs in every cell in the body and between meals or during starvation. Blood glucose levels falls. The hepatocytes, while secreting liver cells, detect this change and restore glucose levels by either glycolysis, which converts glycogen back to glucose, and gluconeogenesis, in which non-sugars such as amino acids are converted to glucose. Fat metabolism. The liver is involved in fat metabolism and synthesizes lipoproteins, cholesterol, and phospholipids essential for many body functions. If fat is in excess, the liver prepares phosphorate. Lipogenesis is the metabolic process in which fats composed of fatty acid and glycerol are converted to phosphorate in subcutaneous tissue and other storage depots. If energy and glucose levels are low, stored fat is converted back into glycerol and fatty acids by a process called lipolysis. This occurs in adipose cells, but the fatty acids and glycerol are transported to the liver for use as an alternative energy supply. Protein metabolism. Amino acids are transported to the liver during digestion, and most of the body protein is synthesized here. A protein is an excess amino acid can be converted into fat and stored in fat depots, or if required, made into glucose for energy by gluconeogenesis, which has already been mentioned. However, before amino acid can be utilized in these ways, the first step is to remove the nitrogen containing amino group in it too. This very important metabolic process is called deamination. In the hepatocytes, NH2, the amino group quickly changes into ammonia, NH3, which is highly toxic to the body. The liver acts fast to convert ammonia into urea that then can be excreted in the urine and eliminated from the body. Detoxification. The liver plays a vital role in detoxification and destruction of endogenous and exogenous harmful substances. The liver's own phagocytes, which reside within the lobules known as covered cells, digest and destroy cellular debris and any invading bacteria. Other exogenous substances such as drugs and alcohols are detoxified by the liver. Amino acids are deaminated, some hormones are inactivated, and bilirubin, a product of the breakdown of ordered blood cells, is also detoxified and rendered harmless by liver metabolism. Storage. The liver plays an important role as a storage facility. The hepatocytes take up many types of vitamins and minerals from the blood and store them. These include vitamin A, B12, D, E, and K, and minerals like iron and copper. Glycogen, which is found from excess glucose, is also stored by the liver, although muscle tissue can also store glycogen too. Bile. The liver synthesizes bile, which is important for fat digestion and is also a route of excretion from the body. Bile consists of water, bile salts, cholesterol, phospholipids, electrolytes, and bile pigments, which gives it its typical yellowish green color. Bile is stored and concentrated in the gallbladder. The presence of fats in the gut during meals stimulates the gallbladder to empty. Bile enters the duodenum, emulsifying fat into smaller globules, which can then be broken down further by lipase enzyme. Metabolic wastes and drugs products may form part of the bile, which can then be excreted from the body through the digestive tract and the feces. Bilirubin, the toxic end product of hemoglobin breakdown, is excreted from the body in this way. This is important point. Pancreas. The pancreas is located in the abdomen. It is pink in color and lies close to the duodenum. It can be divided into three regions: the head, the body, the tail. The head is an expanded portion that lies in the C-shaped region of the duodenum, to which it is intimately attached by connective tissue and which is connected by a common blood supply. The body and tail extend across the midline of the body towards hilum of the spleen. Structure of pancreas. The bulk of pancreas is composed of pancreatic exocrine cells and their associated ducts. Embedded within this exocrine tissue are roughly 1 million small clusters of cells called the islets of Langerhans, which are the endocrine cells of the pancreas and secrete insulin, glucagon, and several other hormones. Pancreas has two main components: acinar cells and ducts. These two constitute 80% to 90% of the pancreatic mass. 20 to 40 acinar cells join into unit called acinus. Acinar cells secrete enzymes, and each acinus and other type of cell called centroacinar cells are present, which are responsible for fluid and electrolyte secretion by the pancreas. Ductal system of pancreas consists of network of conduits that carry the exocrine secretion into the duodenum. The contents of acinus drains into small intercollected ducts and then to interlobular duct, from where it passes into pancreatic duct. Interlobular ducts contribute to fluid and electrolyte secretion along with centroacinar cells. Accounts for only 2% of pancreatic mass. There are nest of cells called islets of Langerhans, which consist of the following four major cell types: Alpha cells secrete glucagon. Beta cells secrete insulin. Delta cells secrete somatostatin. F cells secrete pancreatic polypeptide. Secretion of water and electrolytes originates in the centroacinar and intercollected ducts cells. Pancreatic enzyme originate in the acinar cells. Final product is a colorless, odorless, and alkaline fluid that contains digestive enzymes, amylase, lipase, and trypsinogen. 500 to 800 milliliter pancreatic fluid is secreted per day. This is also important point. Alkaline pH results from secreted bicarbonate which serves to neutralize gastric acid and regulate the pH of the intestine. Enzyme digest carbohydrates, proteins, and fats. Acinar cells secrete isozymes like amylase, lipase, and proteases. These are synthesized in the endoplasmic reticulum of the acinar cells and are packaged in the zymogen granules released from the acinar cells into the lumen of the acinus and then transported into the duodenal lumen where the enzymes are activated. Amylase is the only digestive enzyme secreted by the pancreas in an active form. Its function optimally at pH of 7. It hydrolyzes starch and glycogen to glucose, maltose, maltotriose, and dextrins. Lipase function optimally at pH of 7 to 9. It emulsifies and hydrolyzes fat in the presence of bile salts. Proteases are essential for protein digestion. These are secreted as proenzymes and require activation for proteolytic activity. Duodenal enzyme enterokinase converts trypsinogen to trypsin. Trypsin in turn activates chymotrypsin, elastase, carboxypeptidase, and phospholipase. Relation of bile and pancreatic juice with the secretin hormone. The small intestine periodically receives acid from stomach and is important to put out that fire in a hurry to avoid acid burns. Secretion functions as a type of fireman. It is released in response to acid in small intestine. It stimulates the pancreas and bile duct to release a pool of bicarbonate base, which neutralizes the acid. Secrete is also of some historical interest as it was the first hormone to be discovered. Secretin is secreted in response to one known stimulus, acidification of duodenum, which occurs most commonly when liquefied ingesta from the stomach are released into small intestine. The peripheral target for secretin is the pancreas, which responds by secreting a bicarbonate-rich fluid, which flows into the first part of intestine through the pancreatic duct. Bicarbonate ion as a base and serves to neutralize the acid, thus preventing acid burns and establishing a pH conducive to the action of other digestive enzymes. A similar but quantitatively less important response to secretin is elicited by bile duct cells, resulting in addition bicarbonate being dumped into small gut. As acid is neutralized by bicarbonate, the intestinal pH rises toward neutrality and secretion of secretin is turned up. Disorders related to digestive system and food habits. Following are some of the disorders related to digestive system and general food habits. Ulcer. Destruction of gastric and intestinal mucosal lining of the stomach by hydrochloric acid is direct cause of peptic ulcer. Infection with bacterium Helicobacter pylori is thought to play an important role in causing both gastric and duodenal ulcers. Helicobacter pylori may be transmitted from person to person through contaminated food and water. Injury of the gastric mucal lining and weakening of the mucous defense are also responsible for gastric ulcers. Excess secretion of hydrochloric acid, genetic predisposition, and glycological stress are important contributing factors in the formation and worsening of duodenal ulcers. Another major cause of ulcer is the chronic use of anti-inflammatory medicines such as aspirin. Cigarette smoking is also an important cause of ulcer formation and ulcer treatment failure. The stomach depends itself from hydrochloric acid and pepsin by creating a mucus coating that shields stomach tissue. This is also an important point. By producing bicarbonate and by circulating blood to the stomach lining to aid in cell renewal and repair. If any of these functions are impaired, it can lead to the formation of an ulcer. Peptic ulcers were formerly thought to be caused by stress coffee consumption or spicy foods. Now it is clear that about 60% of peptic ulcers are caused by bacterial infection that can usually be cured. The bacterium H. pylori was established as leading cause of peptic ulcers in early 19th century. It was also found to cause gastritis, inflammation of the stomach lining. H. pylori weakens the stomach defenses by thinning the mucus coating of the stomach, making it more susceptible to the damaging effects of acid and pepsin, inflaming the area, poisoning nearby cells, and producing more stomach acid. Treatment. Most commonly, ulcers related to H. pylori are treated with a 2-week course of treatment called triple therapy, consisting of 2 antibiotics to kill the bacteria and either an acid suppressor or stomach lining shield medication. Obesity. Obesity refers to an increase in total body fat. Obesity or weight gain occurs when we eat more calories than our body uses up. If the food we eat provides more calories than our body needs, the excess is converted to fat. Initially, fat cells increase in size. When they can no longer expand, they increase the number. If we lose weight, the size of the fat cells decreases, but the number of cells does not. Causes of obesity. Obesity, however, has many causes. The reasons for imbalance between calorie intake and consumption vary by individual, age, sex, and genes. Psychological makeup and environmental factors are maybe all may contribute. Genes and environmental factors. Having obese relatives does not guarantee that you will be obese. However, obesity tends to run in families. This is caused by both genes and by shared diet. The most important environmental factor is lifestyle. Your eating habits and activity level are partly learned from the people around you. Overeating and sedentary habits inactively are the most factor for obesity. Age and sex. People tend to lose muscle and gain fat as they grow older. Their metabolism also slows somewhat. Both of these lower their caloric requirements. Men have more muscle than women on average because muscle burns more calories than other types of tissue. Men use more calories than women even at rest. Thus, women are more likely than men to gain weight with same caloric intake. This is also important point. Emotions. Some people overeat because of depression, hopelessness, anger, boredom, and many other reasons that have nothing to do with hunger. Their feelings influence their eating habits, causing them to overeat. Pregnancy. Women tend to weigh an average of 4 to 6 pounds more after a pregnancy than they did before the pregnancy. This weight gain may contribute to obesity in women. Medical condition and medications. Certain medical condition and medication can cause or promote obesity, although these are much less common causes of obesity than overeating and inactivity. Some examples of these are as follows: hypothyroidism, Cushing syndrome, depression, risk factor associated with obesity. It is second leading cause of preventable death after smoking and is associated with type 2 diabetes. Hyperlipidemia, presence of excess lipids in the blood, coronary artery disease, arthritis, gallstones, psychosocial disability, certain cancers, colon, rectum, and prostate in men, ulcer, biliary tract, breast, and ovary in women are more prevalent in the obese. Treatment of obesity. Successful programs for weight loss, reduction, and maintenance should be started and followed under care of physician and nutritionist. A weight loss program may include exercise, 30 minutes of physical activity on most days of the week, daily, a low fat, high complex carbohydrate, high fiber diet, behavior modification to change eating behavior, social support, medications. Bulimia nervosa. Bulimia nervosa is an eating disorder in which a person may eat a lot of food at once and then try to get rid of food by vomiting, using laxatives, or sometimes over exercising. People with bulimia are preoccupied with their weight and body image. Bulimia is associated with depression and other psychiatric disorders and share symptoms with anorexia nervosa and other major eating disorder because many individuals with bulimia can maintain a normal weight. They are able to keep their condition a secret for years. If not treated, bulimia can lead to nutritional deficiencies and even fatal complications. Signs and symptoms. Bulimia is often accompanied by the following signs and symptoms. When eating up high carbohydrate food, usually in secret, exercising for hours, eating until painfully full, going to bathroom during meals, body weight that goes up and down, constipation, diarrhea, nausea, abdominal pain, dehydration, irregular menstruation or lack of menstrual periods in females, damaged tooth enamel, bad breath, sore throat or mouth sores, depression. Treatment. Psychotherapy is a cornerstone of bulimia treatment. Cognitive behavioral therapy, which teaches you to replace negative thoughts and behaviors with healthy ones, is often used. Other mind body and stress reduction techniques such as yoga, tai chi, and meditation may help you become more aware of your body and form a more positive body image. It is important for person with bulimia to be actively involved in their treatment. Antidepressants are often prescribed for bulimia. Anorexia nervosa. Anorexia is an emotional disorder that focuses on food, but it is actually an attempt to deal with perfectionism and a desire to control things by strictly regulating food and weight. People with anorexia have an extreme fear of gaining weight, which causes them to try to maintain weight far less than normal. They will do almost anything to avoid gaining weight, including starving themselves or exercising too much. Anorexia most commonly affects teens Although anorexia seldom appears before puberty, it can be a chronic disease, one that you deal with over your lifetime. But treatment can help you develop a healthier lifestyle and avoid anorexia's complications. Sign and symptoms. The primary sign of anorexia nervosa is severe weight loss. People with anorexia may try to lose weight by severely limiting how much food they eat. They may also exercise excessively. Some people may engage in binging and foraging, similar to bulimia. They may vomit after eating or take laxatives at the same time. The person may insist that they are overweight. Physical signs: excessive weight loss, very rare menstrual periods in females, thinning hair, dry skin, bloated or upset stomach, low blood pressure, fatigue, abnormal heart rhythms, osteoporosis. Psychological and behavioral signs. Anorexia patients have distorted perception of self, insisting they are overweight when they are thin. Being preoccupied with food thoughts, they refuse to eat and also refusing to acknowledge the seriousness of the illness. They suffer from depression and refuse to eat in public. Such patients constantly weigh themselves and do regular exercises. Treatment. The most successful treatment is a combination of psychotherapy, family therapy, and medication. It is important for the person with anorexia to be actively involved in their treatment. Food poisoning. This type of intestinal condition is characterized by sudden illness caused by eating food or drinking liquids contaminated by a toxin or infectious organisms. Poor food hygiene as a risk factor. Symptoms of food poisoning. The symptoms may start hours or days after consuming the contaminated food. Usually, symptoms are confined to the gastrointestinal tract. However, some food poisoning may cause food widespread symptoms. For example, the Clostridium botulinum bacterium causes muscle weakness and paralysis, and listeriosis may cause flu-like symptoms and lead to meningitis. Causes of food poisoning. Most cases of food poisoning results from contamination of food or water by bacteria, viruses, or less commonly protozoan parasites. Unhealthy food hygiene can enable the microorganism to multiply. In some cases of bacterial food poisoning, it is not the presence of the bacteria. The infectious organisms are ingested with the food. They can multiply in the digestive tract. If the food poisoning is caused by a bacterial toxin, they may be produced in the food before it is eaten. Most types of food poisoning cause diarrhea and vomiting, often with abdominal pain. The severity of symptoms and the speed at which they develop, the duration of the illness depend on the cause of food poisoning. Major food poisoning agents: Staphylococcus, Escherichia coli, Salmonella, Campylobacter. Treatment of food poisoning. Treatment of food poisoning is usually aimed at preventing dehydration. In severe cases, fluid and salts may be administered intravenously in hospitals. Typical antibiotics are prescribed only if specific bacteria have been identified. In lab tests, patients usually recover quite rapidly from an attack of food poisoning and rarely experience long-lasting health consequences. In very rare cases, there is a risk of septicemia, a bacteria spread into the bloodstream. Both dehydration and septicemia can cause shock, a condition that is sometimes fatal. Dyspepsia, pain or discomfort in the upper abdomen that is not associated with a structural abnormality. Dyspepsia describes recurrent and persistent indigestion that occurs without an identifiable cause of abnormality of the digestive tract. The condition is more common in adults, especially men, and may be made worse by stress, obesity, smoking, a diet high in rich fatty foods. Symptoms of dyspepsia. The symptoms of dyspepsia may include pain in the upper abdomen, often made worse by eating, and nausea, particularly in the morning. Patients with non-ulcer dyspepsia often experience this symptom several times a week for months. Treatment for dyspepsia. A blood test may be carried out to check for infection of the stomach, leaning from the bacterium Helicobacter pylori. Also, upper digestive tract endoscopy or contrast X-rays may be carried out to look for abnormalities in the gastrointestinal tract. Prevention of dyspepsia. In order to help reduce both the frequency and severity of bouts up indigestion, follow these steps. Eat small portion of food at regular intervals without eating too fast or overfilling your stomach. Avoid eating in the 3 hours before going to bed to allow your body enough time to digest food. Avoid rich fatty foods such as butter and fried foods. Learn to overcome stress, which can often trigger episodes of abdominal discomfort. If overweight, try to reduce weight and avoid tight fitting clothing. If possible, avoid medicines that irritate the digestive tract, such as aspirin and other non-steroidal anti-inflammatory drugs. Key points. Digestion is the process by which food and drink are broken down into their smallest parts so the body can use them to build and nourish cells and to provide energy. Peristalsis occurs throughout the length of the digestive tract and is responsible for keeping things moving. Stomach is subdivided into four regions, which are the cardiac region, the fundus, the body, and the pylorus. A hormone called gastrin controls the secretion of gastric juice. Protein molecules stimulate the endocrine cells of the stomach to secrete gastrin. The small intestine has relatively small diameter. Intestinal walls are covered in rhizomas called rugae, which are themselves covered in millions of finger-like projections called villi. The large intestine is a thick tube which gets progressively narrower in diameter, and it consists of four regions: the cecum, colon, rectum, and anal canal. The liver helps maintain blood glucose level in response to pancreatic hormones, insulin, and glucagon. Lipogenesis is the metabolic process in which fats composed of fatty acids and glycerol are converted for storage in subcutaneous tissue and other storage depots. If energy and glucose levels are low, stored fat is converted back into glycerol and fatty acid by a process called lipolysis. The liver plays a vital role in detoxification and extraction of endogenous and exogenous harmful substances. The bulk of the pancreas is composed of pancreatic exocrine cells and their associated ducts. Pancreatic exocrine cells are arranged in grape-like clusters called acini. Secretion is released in response to acid in the small intestine. It stimulates the pancreas and bile duct to release a food of bicarbonate base, which neutralizes the acids. Destruction of the gastric or intestinal mucosal lining of the stomach by hydrochloric acid is a direct cause of peptic ulcer. Obesity or weight gain occurs when we eat more calories than our body uses up. Bulimia nervosa is an eating disorder in which a person may eat a lot of food at once and then try to get rid of the food by vomiting, using laxatives, or sometimes over exercising. Anorexia is an emotional disorder which deals with perfectionism and a desire to control things by strictly regulating food and weight. Dyspepsia describes recurrent and persistent indigestion that occurs without an identifiable cause of abnormality of the digestive tract. After that, we will start another chapter.